Here's top American epidemiologist, our friend Dr. Michael Osterholm's prediction for the next few months as some states loosen restrictions and officials work to accelerate school reopenings.
The next 14 weeks, I think, will be the worst of the pandemic. People don't want to hear that. But if we look at what these variants are doing, particularly this one from the United Kingdom, and see what it did in Europe, see what it's done in the Middle East, it's now beginning to start that here in the United States. Yeah. We are going to see that unfold. So overall, with schools, they have to fit into that. And I think what we're going to see is big efforts to open the schools. We will get some open beyond what we have now, but then it's going to likely be a real challenge for them in the next 6 to 8 weeks as these surge numbers begin to increase. And this will last for at least likely up to 14 weeks.
Turning our conversation, MSNBC medical contributor Dr. Lipi Roy, internal medicine physician, and someone we turn to when the news is hopeful and when the news is bleak, like that prediction from Dr. Osterholm. Is that what we should be bracing for?
Well, Nicolle, it's good to be with you. Let's just take a step back. We now have 27 million cases or infections in the United States. Over 485,000 lives have been lost. We are still very much in the midst of a pandemic. While there are some promising signs with overall cases going down, hospitalizations going down, we have all of these variants, as Professor Osterholm mentioned, and Dr. Fauci and many other experts have mentioned, variants all over the world. And look, it's not actually surprising. We know that viruses mutate. Their sole purpose is to survive and to thrive. We just want to make sure that we do not create more of an environment that's conducive for the virus to continue to mutate and survive and thrive. The UK variant, as you already know, Nicolle, B117, has found to be not only more transmissible, but studies are now suggesting that it can be anywhere from 30 to 70% more lethal. We're not really sure why that is, but why it could be more deadlier. We think that it's because it can confer a higher viral load, and a higher viral load or viral burden has been associated with increased disease severity. But I am hopeful, Nicolle, that if we continue to practice, really double down on mitigation measures, we can still fight this, Nicolle.
You know, one of the debates I think that is really straining communities from coast to coast is about how to reopen schools with a serious mental health impact on our youngest and our treasures, as well as our teachers. There's no one to teach our kids if teachers won't go because they don't feel safe or, heaven forbid, get sick or lose their lives. How do you lay over the really terrifying new data about the variants with this equally urgent need to get our kids back into school?
Yeah, a really important topic. It's our education system and keeping our children educated, but while also keeping teachers and other adults in the education system safe. First of all, let's take a step back. I am so reassured that we finally have a plan. The CDC has released actual guidance. As you know, Nicolle, public health people like me have been begging the federal government since last year for an actual national plan, specific guidance. And the CDC guidance has just come out with specific plans and recommendations that are rooted in science, not just speculation or conjecture. And what they're recommending is that masks, distancing between seats within classrooms, good ventilation, and contact tracing are really mitigation measures that will keep both students and teachers and other adults safe.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.